Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. Further to my right is the Minister of Education, Jennifer Whiteside. And this is our COVID-19 update for Wednesday, December the 29th. We're honored to be here on the territories of the Musqueam, of the Squamish, of the Tsleil-Waututh First Nations. Honored to be here today on their lands. Just in terms of an update, what you can both expect today and expect in terms of schedule the rest of the week. Dr. Henry and I will be providing an update on the COVID-19 pandemic in BC on New Year's Eve on Friday, December the 31st at 10 a.m. From here in Vancouver. So you can plan on that for that day. And today you'll be hearing from Dr. Henry with the previous style, I guess, of presentation of case counts and other things, as well as information about the COVID-19 pandemic in BC. Then you'll be hearing from Minister Jennifer Whiteside on some of the impacts of the Omicron variant of concern on education, followed by an update from me on vaccinations and other issues. And with that, it's my honor to introduce Dr. Bonnie Henry.
Thank you very much, and good afternoon. While we were able to provide preliminary numbers over the last few days, I wanted to update that with some of the confirmed numbers from today and to let you know that the updated confirmed numbers will be posted in our statement later today, but also on the BC CDC dashboard. So in the last 24 hours, we have confirmed 2,944 new cases of COVID-19 here in British Columbia, and and health authority active cases are as follows. There are 5,462 in the Vancouver Coastal Health Region, 7,192 in Fraser Health, 1,363 in Vancouver Island Health Authority, 1,576 in the Interior Health Authority, and 431 active cases in the Northern Health Authority, for a total of 16,014 active cases who have been tested across the province. One of the other things, of course, that we have been watching carefully is our hospitalization rates for people with COVID, and that is at 193 people hospitalized with COVID-19 today, 66 of whom are in critical care or ICU. And since December 24th, we've had an additional 5 people who have died in British Columbia from COVID-19, bringing the total number of deaths from COVID-19 to 2,419. And as always, our condolences and our thoughts go out to all of those who have lost loved ones during this pandemic. So a complete reporting of the confirmed data will be in the statement, as I said, later today. As we talked about prior to the holiday long weekend here, Omicron has left us with more questions than answers, but it also is different, and it is spreading through our communities in a way that is different from other variants that we've seen over the past 2 years. People are getting infected with a much smaller dose of the virus, and much more quickly. And they are passing it on to others, often before they realize that that they're able to transmit it. The rate of transmission has impacted a number of different parts of our system that we've had in place, including the effectiveness of contact tracing. The incubation period is fast, and we've now seen that piece of the puzzle come together, both here in BC from the data we have, but also what we're seeing across the country and in other countries globally. The incubation period is now down to a median of about 3 days, from an average of about 6 days with previous variants even as late as a month ago. Which means by the time you develop symptoms and get tested, get that result back, you will likely have exposed others and passed it on to some of them. And as we've seen before, it spreads to the people that we are closest with, the people we live with, the people we socialize with, our family, our friends, our social connections. As a result, we all need to be paying more attention. We talked about this before going into the weekend. Close attention to 2 things: how we are feeling and who we will be spending time with, to make sure that we're not putting people at risk. The puzzle is coming together around Omicron. We are learning more about how fast it spreads, how infectious it is, and it is very clear that it is increasingly transmissible with this shorter incubation period that now is more and more defined. We know as well that you're 10 times more likely to be reinfected if you have been infected before and are not yet vaccinated. And we know that Omicron is causing more breakthrough infections in people who have been vaccinated. But some of the things that we are learning is that particularly people who have 2 doses of vaccine on board, who have been fully vaccinated, regardless of how long ago that was, are much more likely to have milder illness or asymptomatic illness if they do get infected. But given this rate of transmission, if you have any symptoms of COVID-19, you really must assume that you have the virus and take measures to avoid passing it on to others. That means making sure that you're wearing masks in appropriate places, that you stay away from people who may have increased risk, and that if you are not fully vaccinated as well, you are more likely to have more severe illness. The best thing we can do is make sure that we're staying away from others if we are sick ourselves, to rest, drink plenty of fluids, and get medical help if our symptoms worsen. If you're having difficulty breathing, having chest pain, having difficulty drinking or eating, or your self-care is not helping you manage, then contact 811, or if you need to, make sure that you can seek immediate care and call 911 if you need to. There is additional details about self-management on the BC CDC website that can help you understand the things that can help. If you are a close contact of somebody with COVID-19, you do not need to self-isolate if you're fully vaccinated. But you do need to monitor for symptoms for 14 days, and you need to pay attention because you may be incubating it yourself, and you need to be extra cautious about wearing masks when you're around others and delaying gatherings and visits, particularly to people who are vulnerable. As many people have experienced, our testing centres are now at their maximum capacity, and we have been doing a lot of testing over this past few days, despite things like the weather and dealing with the issues that we've had with some of our testing centres. Our BC CDC symptom checker is a good tool to use if you're unsure about whether you need to get a test. The PCR tests, the more accurate PCR tests, are being used, and we're triaging those to make sure they're available for those who are highest risk, so people who have a high risk of having more severe illness, or for people who need to know whether they have COVID to be able to safely return to work, and particularly making sure that they are available to support our healthcare workers and emergency responders and others. Rapid testing that we have available in the province is now being used across the province to supplement at our testing centres for those who are at lower risk of having severe disease, but people with symptoms where it can help understand if they have COVID or not. If you are a healthcare worker, please do go and get tested and connect with your employment right away. The encouraging trend that we are seeing around the world is that for most people who are fully vaccinated, illness continues to be mild. And for many people, that means if you have mild illness, you can self-manage at home and you don't need a test. Booster doses are also providing added protection to those who are at highest risk, which is why we're continuing to follow the approach of 6 months based on interval from your dose 2 and age being the number one risk factor. I will say as well that we are continuing our surveillance reporting, the numbers I reported today, which are based primarily on our PCR testing. And that is something that has been consistent. We know that every day the case numbers have a lot to do with how many people are tested where and the capacity at our laboratory. But surveillance is looking at trends over time, and that is the other important things that we look at. So the 7-day rolling average helps us understand trends over time. As well, we have other surveillance streams that augment and support our testing. We look at things like the rate of testing in different communities in different parts of the province and by age. We look at the percent positive in our testing in the different places. We now have an online reporting tool for rapid testing, and that will give us a sense of how many people are reporting that their rapid test was positive. That's just another piece that helps us put together the picture of how this virus is moving through our community in this wave. As a result of the widespread transmission of Omicron, we are seeing higher levels of absenteeism as people become sick, with people needing to stay away from work. And we know that schools reflect what is happening in our communities, and this is affecting our healthcare system as well as other aspects of our society. With this in mind, I have directed the Ministry of Education through an order to take a phased restart for our K-12 schools over the coming weeks. All schools will open on either January 3rd or 4th as planned for children of essential workers and those with special needs, with full return to classes for all students on January 10th. This will give us time to add additional protocols to reduce crowding and stagger times for recesses, those things that we did early on that we know can help reduce the potential for transmission within the settings. As well, school administrators will use this phased approach to address things like making sure we can continue to safely have classes, to address absenteeism and program continuity. We'll also be working very closely with public health in our schools to adjust our testing strategy and to modify our public health notification and working with the schools to make sure that we can put in place measures that help us understand how Omicron is affecting the schools as well. So these revised protocols for notification of staff and student illness and absenteeism, given the spread in the community and the changes to contact tracing. And Minister Whitehead, who's here, will address these details in a few minutes. Whiteside, I'm sorry. So we are learning more. Every day, more of these pieces about Omicron come together. What we don't yet know for sure is how severe this illness will be as more and more people are infected, and how that will impact our healthcare system. We do know, and what we're seeing across the globe and here in BC, is that vaccines make a huge difference. Vaccines work. They may not stop all transmission, but our vaccine effectiveness at preventing severe illness is still very high, and we see that with data from the BC CDC. We've seen that in places across the country, where even older people who are testing positive are not ending up in hospital. And that is the good news right now. But we are not yet at that place where we can say that for sure, and we need to continue to monitor, and that's why we're taking some of these measures today. What we have done collectively has bought us time. It helps us understand more, to ramp up our vaccination, our booster program, to modify our testing so that we know we have the strategies in place that are needed. What we need to know right now is, this week we are seeing that hospitalizations in critical care are holding steady, but we still are having impacts, and uncertainty is still a challenge for us, but we will know more in a week. We are once again in a new phase of our pandemic, and we must continue to evolve and adapt our approach. That's why we're continuing to act to protect our healthcare system, our schools, our communities, and all of us. Despite all of our best efforts, we are not going to prevent this wave, but we do all need to continue to do our part to make sure that we're mitigating it as best we can. This means using all of our layers of protection are even more important now. And paying attention to how we are feeling and who we are spending time with. And we know that people will become ill with this new infectious strain, despite all we are doing. And we need to support them. This is just what happens when you have a highly infectious respiratory virus. We need to offer compassion without judgment. And I know it's discouraging sometimes to think that despite everything we're doing, we are going to be exposed to it. We are seeing it move very quickly through our communities. But we do have control. We have control about the things that we can do for ourselves, to protect ourselves and our family, and to support our family. Things that we can do, including upping our mask game, making sure we have a good quality 3-layer mask, or using surgical masks or KN95s in those certain situations where we can't avoid indoor crowded settings. Getting vaccinated, we know that that is what is protecting us the most right now, whether it's your first dose, your second dose, or when you're invited for your booster dose. Give people the space they need. That is an important part of all of the different layers that we have. Keeping those barriers that we have in place, being respectful when you go into a grocery store or the drugstore, wearing your mask, giving people space. Those are things that we do to support each other right now. Avoiding crowds, and particularly if you are concerned at all, if anybody in your social circle has COVID, if you're feeling unwell yourself, please do not go to visit your loved ones in long-term care. Do not go to visit people who may be at greater risk from this strain of the virus as well. As we look to the end of 2021 and the start of a new year, we need to give each other a booster shot of kindness once again and make sure that we get through this together by being kind, being calm, and being safe. Thank you, and I'll now turn it over to Minister Whiteside.
Thank you, Dr. Henry, Minister Dix. My name is Jennifer Whiteside. I'm BC's Minister of Education, and it's an honour to be here today on the traditional territory of the Musqueam, Squamish, and Tsleil-Waututh First Nations. And I want to start by first highlighting the incredibly hard work that all of our teachers, our school staff, administrators, school leadership, district leadership, trustees, rights holders, parents, and of course all of our partners in the K-12 system, all of the work that's gone into keeping our schools open and safe over the last 2 years and providing crucial face-to-face instruction to students across BC. It is a testament to the monumental efforts of everyone in the system that BC has been able to continue delivering in-class learning while so many other jurisdictions did not. We know that face-to-face learning is important for the intellectual, social, and emotional development of students, and that schools are more than just a place of learning. They also provide important supports for students who may need a bit of extra help, whether that is in the form of mental health services or hot meals or other programs. So our primary goal is to continue the work to keep students learning safely in person for the remainder of this school year. The rapid emergence of the Omicron variant means that we have to ensure we have the foundations in place to keep our schools safely open. And that is why, as Dr. Henry has announced, we will have a phased approach for the return to school, with students returning to school on Monday, January 10th, staff returning to school next week on January 3rd and 4th. And this delayed start will allow public health and education time to assess the impact of the Omicron variant in our communities and on our education system. And it will also provide teachers, staff, and administrators time to prepare for students safely returning to class with enhanced safety measures. This additional time will also allow schools to proactively implement continuity of learning plans to meet the unique challenges that we face. During this time, schools will be open for students whose parents are healthcare workers and for those students with support needs who require care. Parents are encouraged to reach out to their school principal to make those arrangements. Over the past 2 weeks, Ministry of Education staff have worked very closely with the BC Centre for Disease Control and with all of our education partners to develop enhanced safety measures that are based on public health's current knowledge of the new variant. And these changes will be published in an addendum to the provincial COVID-19 communicable diseases guideline for K-12 schools and are in addition to the existing guidelines in our schools, which have continued to reduce the spread of the virus. Many of these measures will look very familiar as they were part of our original safety plans. As students head back to school, schools must reinforce the existing measures, including maximizing space between people and ensuring all who are able to wear a mask. Some of the enhanced measures that will be enacted include reinforcing the importance of the daily health checks and ensuring that you stay home if sick. Implementing strategies to prevent crowding during class transition times, such as staggering start and stop times or recess times, break times. Holding school gatherings and events such as assemblies in a virtual format. Holding staff-only gatherings virtually. Limiting visitors to those who are supporting activities that directly benefit student learning and well-being, such as teacher candidates, immunizers, or meal program volunteers, and pausing extracurricular sports tournaments. These guidelines build on existing protocols that have successfully minimized the spread of the virus in our schools. And these existing guidelines include encouraging everyone who is eligible to get fully vaccinated, cleaning hands regularly, cleaning and disinfecting surfaces at least once a day. And these measures are based on what public health has advised and knows are successful strategies. And as we have done throughout the pandemic, safety measures for schools will continue to be updated as needed in consultation and at the direction of public health. Schools will use the next week to implement enhanced safety plans. Staff, school leadership and district leadership will be determining their workforce needs and developing continuity of learning plans. As we know, the pandemic is changing, but we have shown that the education system is nimble, smart, and strong. And we are taking these proactive steps to reduce any further disruptions in our school year. Our efforts are truly focused on working to reduce disruption and reduce absenteeism in our schools. We know it's been a very long year for students. And while some may be excited for an extended winter break, we know that many families depend on our schools being open. And it's critical for them to have our schools running as smoothly as possible for the duration of the school year. But taking a few extra days now for planning and preparation, by doing so, we are setting up our schools for the best possible start. The ever-changing nature of this pandemic is challenging for all of us, and we are going to keep working closely with public health, with all of our education partners to ensure in the days and weeks ahead that we have the right measures in place to keep students and staff safe in schools. Thank you very much, and I'll turn it back to Minister Dix.
Thank you very much, Minister Whiteside. Dr. Henry, I just wanted to update you on a few important initiatives that are going on with respect to the COVID-19 pandemic. I want to firstly thank our healthcare teams across BC for the truly exceptional work that they did this weekend under challenging conditions. This Christmas weekend, well, there's certainly healthcare incidents, and the normal Christmas weekend was, for many of them, expected to be a time of greater rest, and of course it was not. Just to put that in context, on this Christmas Eve and Christmas Day, that 24th to 25th period that Dr. Henry, that will be reported on in our 3 o'clock our 3 o'clock statement, or our statement that comes out after 3 o'clock, I guess it is now, 4 o'clock or 4:30. On that day, 19,681 lab tests were completed for COVID-19 in BC, 19,681. Over the weekend, the Christmas weekend and the stat holidays, 75,000 lab tests were completed, which represents each of it exceptional work by our nurses and our teams at collection stations and by our extraordinary teams in the labs at the BC CDC, the health authorities, and around BC, including at Life Labs. And we want to thank all of them for doing such exceptional work this weekend. I want to just note, because often we have talked at different times of the pandemic how regions are affected differently. With respect to the Omicron variant of concern, our 7-day rolling average of positivity is 14.49%, and that is virtually the same, with very little variation between all 5 health authorities. In short, our 7-day rolling average, I should say, overall for COVID-19, 14.49%. Obviously, that's higher yesterday than it was 7 days ago. So that's an average. It would have been about 10% 7 days ago, 20% yesterday. But that 14.49% is really the same in every health authority. So wherever you live in BC, it's important to follow public health guidance and public health orders. Secondly, with respect to our acute care capacity in the province and how many people are in acute care today, as you'll know, we have 9,229 base beds in BC, 2,353 surge beds for a total of 11,582 total beds. The number of people in acute care today is 8,669. Or significantly less than it was, say, 3 to 4 weeks ago, but still a very significant number. And our challenge is to ensure that we have sufficient capacity to deal with COVID-19 patients and patients who are living and dealing with the Omicron variant of concern. In critical care, there are 510 base beds and 218 surge beds for a total of 728. There were 420 people in critical care in BC as of this morning. So we are making adjustments and creating a capacity for an expected increase in acute care and critical care patients. And as you'll see, the numbers aren't quite showing that yet, as you would expect. There's a lag effect here, but there were 206 people in hospital COVID-19 yesterday and 62 in critical care. So we are making preparations and preparing the way for that. And finally, I want to just take you through an update on our accelerated booster campaign. It is worth remembering the significant strides in immunization that we've made in combating this pandemic. This includes a major vaccine campaign with 9,337,772 COVID-19 vaccines administered, 4,111,560 British Columbians vaccinated with 2 doses, more than 125,000 children 5 to 11 now vaccinated with their pediatric COVID vaccine. With respect to boosters, as of today, 858,774 boosters have been administered in BC. That's significantly more, 128,000 more than originally was to be forecast by the end of 2021 in the plan we laid out in October. That includes 503,870 for people aged 70 and above, 591,983 for people aged 65 and above. That's 56% of the total. 84,000 healthcare workers, 151,621 people who are clinically extremely vulnerable, and 34,168 people living in assisted living and long-term care. More than 50% of Indigenous people in BC have received their booster dose. And the number of British Columbians with boosters will continue to grow as we expand and accelerate the booster program. In the last 10 days, 210,000 people have received invitations for their booster shots. In addition, 135,000 people aged 61 and 62 become eligible and will receive their invitations in the next 24 hours. Another 30,000 people aged 60 will hit 6 months this week, and invitations from them will go out also starting tomorrow. And we continue to go out daily with invites for those who become eligible based on their intervals. Anyone 70 plus, that's a 5-month interval. Healthcare workers, clinically extremely vulnerable in all categories, including the third group, and people who received AstraZeneca for doses 1 and 2. Indigenous people 18 and above on a 5-month interval. Our vaccination clinics are running at expanded capacity, thanks in large part to the more than 500 community pharmacies that are involved in the program, who this week did 48,000 immunizations, with more to come every week for the next 5 weeks. Health authority clinics and pharmacies have more than 482,000 open appointments now through January 30th, and more appointments are being added every day and every week. For the remainder of this week, for example, we have 12,000 available appointments. If you're one of the 240,000 British Columbians who've gotten your booster invitation but you haven't booked your appointment yet, do it now. Getting your booster protects you, protects those around you, and helps our healthcare workers. And this is especially important for those who are healthcare workers, who've received the invitation to book. They need to get their booster doses today. There's always thought, I think, in this time of year, what the year ahead will hold. And this year, especially at this moment in our BC pandemic, it is, I believe, reassuring to remember that so much of what lies ahead remains within our control. It doesn't feel that way with the Omicron variant of concern, and yet it's the case. Getting vaccinated, getting our boosters, protecting our children aged 5 to 11 with their vaccines, adhering to public health orders, following the latest public health guidance, and using our COVID sense. All these give us control over a virus that spreads to live and seeks out every opportunity we give it to spread, renewing our commitment to taking these actions, especially when we're tired and worn down by COVID. If we take each of these actions, if we do this, then the promise of 2020 will be that which we would hope for such a year. And it's the greatest chance for experiencing a 2022, I should say, that works well for everybody, is to do exactly that, to use the control we have to protect ourselves, to protect our families, to protect our communities, to protect our friends, to protect our province, and to help people around our country and our world, to protect all of us from the COVID-19 pandemic. With that, we're happy to take your questions.
As a reminder to media on the phone, please press *1 to enter the queue. You will be limited to one question and one follow-up. Please also remember to take your phone off mute. You will not be audible until your name is called. Our first question today is from Ben Milger, CTV. Please go ahead.
Thank you. State Schools Coalition is calling for air filters and CO2 monitors to keep track of air quality in classrooms. Is there any money available and are any plans in place to improve ventilation in schools?
I will turn that over to Minister Whiteside. I will say, though, that from the very beginning, ventilation has been one of the layers that we have been focusing on in schools across the province, and there has been a lot of work done on that, particularly in the summer of 2020 and again last summer when schools were on breaks. But, Minister, you...
Thank you for the question. With respect to ventilation, we have made significant investments in HVAC systems across our education system. We've invested well in excess of $300,000 over the last $1 million over the last 2 school years, which districts have used to upgrade their systems, in some cases to purchase portable air filtration units where there is not mechanical HVAC available. We have been working with our education partners throughout this year to identify areas where we need to support districts to continue to do the work that they're doing to upgrade their systems, and that work will carry on, and we'll be looking at what the needs are in that respect.
And did you have a follow-up?
Yes, I do. This one is for Dr. Henry. Dr. Henry, people at low risk with symptoms have been advised to isolate, but told they don't necessarily need to get a test to confirm that they have COVID. So the number that came out today, the 2,944, likely isn't a true representation of the new cases in the province in the last 24 hours. You touted the different statistical tools at your disposal. Based on those tools, do you have an estimate of the true number of new daily cases that we are averaging, not just the confirmed positives from PCR tests?
Yeah, so the PCR testing is one, and the rate of testing is one of the surveillance tools that we've used all along. So it is a consistent, and that's one of the hallmarks of a surveillance tool, that it tells you the trends over time using that methodology. But yes, all along, we know that the daily numbers are not reflecting everybody who has COVID in our province. That has been the case from the very beginning, and at different periods of time, the actual true number can be varied by 4 or 5 times what we're seeing in terms of PCR testing. So I don't have an exact number for the last weekend, but we do know a small amount of the people who had rapid tests, who went to the testing centers, who reported. Plus, we know a little bit from early on in the pandemic where we had limited testing capacity. And on average, there's probably 3 to 4 times the number of people who truly have COVID than what is in our surveillance numbers on a daily basis. And that is something that we've seen throughout this pandemic. That it varies by community as well, by where we see transmission happening in communities. But right now, that's very likely to be the same differential across the province, because we are seeing, with the exception of the north, right now, we're seeing these very high percent positivity in the PCR testing across the province. So that gives us a sense of how this virus, this new strain, is spreading in many communities across the province.
Our next question is from Mike Hager at Globe and Mail. Please go ahead.
Hi there. Thanks a lot. Quebec just shortened its isolation period for doubly vaxxed healthcare workers to 7 days. BC's guidance was changed to 7 days. It appears recently. Can you explain why and when that was changed from 10 to 7 days for all doubly vaxxed people to self-isolate? And will BC follow the U.S. CDC's lowering of this period to 5 days?
Yeah, so we actually changed that based on data that we saw around how people were getting infected and how long they were infectious if they were vaccinated several months ago. So in the summer, we changed our public health guidance around what we were telling people who were cases, depending on their vaccination status. So we had changed to 7 days quite some time ago. We shared that information with our colleagues across the country, and I know we've been talking about the data that shows that people who are vaccinated are less likely to get infected, have milder illness, and shed less virus for a shorter period of time. And that's why we went with 7 days a few months ago. We know that for people who are not vaccinated, they still have a much longer period of time and shed more virus, so therefore are likely to be more infectious to others. We are looking very carefully at the data from the U.S. and the data that we are now accumulating of people infected with Omicron. And what one of the things that we have looked at here with our data is that incubation period, which shows that people are, and I talked a little bit about this last week, now that we see that a smaller amount of the virus can bind more strongly to the ACE2 receptors in our nasopharyngeal area, so the upper nose and throat, and that you can start replicating and shedding virus before you have symptoms yourself. What we are seeing here, which is very similar to what the US CDC based their data on, is that people tend to be infectious a day or two before they feel symptoms, but that the symptoms tend to be mild and drop off quickly. So we are looking at that very carefully, and whether we can shorten that period of infectivity. It's all about risk and mitigating the risk, because we know that some people will shed for longer. People who have a compromised immune systems, for example, can shed some virus for an even longer period of time. So being able to also get people back to work sooner if they have milder illness with other precautions in place. So making sure that we add wearing of masks, for example, keeping distances, making sure you're not in a crowded environment. And one of the things that we're very concerned about is healthcare workers becoming becoming sick with Omicron in the next little while, and seeing if there's ways that we can have healthcare workers, for example, with very mild or asymptomatic cases, working in some aspects of healthcare with appropriate precautions in place. So yes, we are looking at those in detail, and my team will be looking at that, and we'll be revising our advice as the data becomes available.
Mike, did you have a follow-up?
Yeah, what are you seeing in terms of staffing in first responders? We've talked to firefighting departments that want this period to be down to 5 days, and in the U.S., a third of the workforce is off in some departments with Omicron infections. So when and what will drive this decision if you do lower that limit to 5 days? And how is staffing across hospitals, fire departments, police?
We are starting to see the impact a little bit. It's very hard to tell, but certainly in healthcare, we're starting to see absenteeism from Omicron, mostly with mild illness. As you know, all healthcare workers are vaccinated. So somewhat different situation than what they were seeing in the U.S., where their vaccination rates are lower, so having more and more challenges with people getting quite sick. So that is something that we are looking at actively right now. So we will be making a decision in the next little while based on our data. But we expect that we are going to see increasing absenteeism given the rates of transmission we're seeing in the community. So it is a consideration. One of the other considerations that we made some changes some months ago around people who are vaccinated who have had close contact with somebody with Omicron do not need to quarantine or isolate for that potential incubation period. You can continue to go to work with using appropriate masking and self-monitoring to be sure that you're not passing it on in the workplace setting. And so that's another part of it that helps preserve our health, our workforces in those different essential settings. But this is certainly something I'll have more to say on very soon.
Our next question is from Richard Zussman, Global. Please go ahead.
This is for Dr. Henry and Minister Whiteside. Is there any consideration being given to fast-track teachers and school staff for booster shots, considering many of them will be sort of in their 30s, 40s, could be waiting up to 8 months between second and third dose? Is there any thought about prioritizing them? And what happens to the kids, the children of tens of thousands of school staff, when teachers and staff are back next week? What happens to these kids? How is support being done there?
Yeah, so we prioritize teachers and school staff, all school staff, as you know, for vaccination early on. So they do come up to their 6 months at a sooner period by age. So yes, we absolutely, many people who are, any school staff who are in their 60s will have, and have at 6 months, will get that invite if they haven't already. And by next week, they'll be down into the 50s. And it will be moving through very quickly as we ramp up over the next few weeks. So no, I do not expect any school staff or anybody who received their vaccine as we prioritize them to be waiting 8 months at all. They'll be moved up to the 6 months soon. And in terms of, you want to address the issue around supporting other?
Thanks, Richard. I do want to say that we understand that this will be disruptive for many families next week, which is why we wanted to ensure that we could get the information out about the delay of the return of students to school as soon as possible. We are going to continue to work with, certainly work with districts to ensure that for those in those essential situations where we have children with vulnerable needs who need access to schools, that we can organize for that next week. But I think we're in a situation where we need to act proactively now to ensure we can try to minimize the disruption and minimize absenteeism down the road. We want to have a successful return of students to school, and we need the time to invest in the assessment and planning, particularly to assess the impact on the workforce that we can anticipate will have happened over the course of the holidays.
Richard, did you have a follow-up?
Dr. Henry, Quebec just announced that they are going to be allowing sick healthcare workers to work in the healthcare system. Alberta has decided that they are going to allow those who are terminated due to not being vaccinated to return to work. Is BC considering either of these options to help protect the healthcare system? And also to this absenteeism that you spoke to, what are businesses supposed to do, including schools, if there are people who are sick or showing symptoms and can't get a test? Like, are these businesses, are you just expecting them to close if they can't find staff to remain open?
Yeah, so, thinking about business continuity is something that we all need to do through this. And there needs to be thinking through that. And that's one of the things that we're doing with schools, one of the things that we've been doing all along with healthcare. And yes, we are looking at fitness for work for people who have mild illness in the healthcare setting. And that is something that we have had preliminary plans for, but we're working with the occupational health and safety folk to make sure that we have those criteria identified for healthcare workers, and making sure we also have plans to be able to substitute other workers and move workers around as needed. Obviously, if somebody is sick, whether it's with COVID or with any other illness, we don't want them in a workplace setting because it is a risk to others. But there are certain settings where we need to make sure that we have that balancing of continuity of care. Healthcare workers are one, police services, fire services. So we need to look at what are the measures that need to be in place to ensure that particularly people who have very mild illness or are asymptomatic are able to safely do work in those workplaces if needed. So those are all things that are in flux. It is a reality that for some businesses, if they have a lot of people off sick who aren't able to work, they'll need to find ways to either have additional staff or they may need to close. And this has been a reality through this pandemic, where if workers aren't vaccinated, for example, and you have workers transmitting to each other, that businesses have to close because they don't have enough people to care or to carry on their business. But these are things we want to prevent, and the best way to prevent them is by making sure that everybody in your setting is vaccinated and that we have those COVID safety plans, that thinking that we had that worked for us through the last part of this last 20 months or 24 months. So going back to thinking about what are the things that we have in place before we had vaccination that help us protect workers. So those barriers, the plexiglass that was in before, keeping space, making sure masking, making sure that workers aren't gathering together and having lunch together in a small break room. Those are all the things we need to go back to thinking as this strain is spreading through our communities right now.
Our next question is from Lisa Yuzda, City News. Please go ahead.
Just following up on what Richard asked about the teachers and school staff going back to work next week who have children, are you saying that they will have to find alternate means of taking care of their kids, which I've understood in the past was a concern because it's, putting kids together in group home settings that could possibly lead to more transmission? So is that what you're saying parents are going to have to do, or will parents who are also teachers and staff be allowed to send their kids to school as they would be essential, children of essential workers?
That's correct. So we're not closing schools. We're not going to online learning. What we're doing is having a phased approach to full back to school, and doing that in a way that allows us to make sure we're following what's happening in our communities. So my understanding, and yes, teachers will be able to, children of teachers, essential workers, healthcare workers, will be in school next week.
Lisa, did you have a follow-up?
You mentioned, Minister Whiteside, about the notification process and what's going to happen, that would be revamped. So I'm wondering if you can talk about what that is. And also if you can talk about, there were some other measures the BCTF wanted to see, which was N95s for teachers and enhanced masking or following up of masking for students. And I'm wondering if you can talk about, will there be additional masks of greater, protection available for staff and or students?
So I can talk a little bit about the notification, because this is something we're working very closely on. As I said, in the past, what we have done is notified every case and when there's thought to have been transmission within a setting, so clusters and, of course, outbreaks. And with the rapid transmission that we're seeing, it's not possible to do each type of case notification as we did before. So we're working very closely with the schools about how they will notify parents about what's happening in the school community, of course, reflecting what's happening in the broader community. But we cannot expect to have that same individual case reporting and case follow-up anymore. Just because of what is happening about the rapid transmission, it is too far behind to make a difference. And so this is part of the message that all of us need to think about right now as we're going through this next new phase that's being driven by thankfully, for most of us, milder virus that is transmitted more rapidly. We need to be able to notify those in our social contacts, in our close contacts, and let them know if we have COVID or if we're sick, so that people can take those appropriate precautions to stay away from larger gatherings, to stay away from people who may be most at risk during that period. So these are all the things that we have to do now to adapt to this new changing situation. And part of what we'll be doing next week is working very closely with the schools about how that will look with public health working with each individual schools across the province. But it cannot be the same as what we have been doing all along, and we'll need to work together to make sure that we're appropriately notifying people about what the risk is. I think we can also be really reassured that, with other illnesses that we've seen, with what we've known about COVID all along, we know that our classroom settings in particular are safe. And they're not the places that are amplifying the transmission of this virus. And we don't expect that to be any different with Omicron. We still know that the people we get infected and the people we infect are our close contacts, our social connections, our family, those we're closest to. And you want to address the other?
Thanks, Lisa. Just with respect to, I don't have anything more really to add about the communication piece other than to say that I understand that parents and school communities will want to have an understanding of what's happening in schools, and that will very much be the work that's undertaken with at both a provincial and a local level between public health and education over the coming days. With respect to masking, we've certainly heard about from the school communities about the need to reinforce appropriate mask wearing to support children around appropriate mask wearing, and ensure that we have sufficient supplies available of the 3-ply masks that we've been providing throughout the pandemic, and that we will continue to provide. So that is also a work that will be undertaken next week.
Our next question is from Lisa Cordasco, Vancouver Sun. Please go ahead.
Thank you. Dr. Henry, you said that this is a different game that we're in now. But the rules about PPE by the Ministry of Health has not changed since March of 2020 when this pandemic began. So given the Omicron transmissibility in communities right now, will you change the Ministry of Health PPE policy to allow healthcare workers to decide themselves when to use an N95 mask without having to go through the point of care assessment and then getting approval from a supervisor?
So I think you're talking about two different things here, Lisa. One is what's happening in the community about the transmissibility of the virus, but the measures that we have in place, the infection prevention and control guidelines in our healthcare settings, in all healthcare settings, And that guidance is robust. It continues to be robust, and it continues to rely on a whole bunch of things. So engineering controls, and we've talked a lot about ventilation in hospitals with some of you and your colleagues. We've talked a lot about the measures that are in place. There's administrative measures, so there are higher risk settings and lower risk settings that we know, even in healthcare. So if you're working at a vaccination clinic, for example, where there is not people who are ill for the most part, the level of PPE that you need as the last line of defense is different from working in a COVID ward or an ICU or the emergency department, where the acuity and the types of things that people are coming in with are different. So the point of care risk assessment is a basis for every healthcare worker, for every encounter that we have with a patient, that helps us understand what is that last line of defense that we need, knowing that everything else is in place as well. So that means masks on people coming in. And so the bottom line is, when we've reviewed that information, yes, you have to continue to do that. And N95 respirators are widely available and being used, as our elastomeric half-face respirators in ICUs, in COVID wards, in those higher risk settings now, and will continue to be. And they'll be continued. The guidance that we have allows for that, and allows for that that individualized assessment to happen on an ongoing basis.
Lisa, did you have a follow-up?
According to the BC Nurses Union, despite the policy that's in place, it is applied in a very spotty manner. Some nurses have easy access to N95s, others do not, yet they could be working under the very same conditions. The policy itself only refers to the spread being by droplets. The policy was written in 2020 when you had a shortage of N95. Why is there any resistance at all to allowing nurses to make their own decisions and having easy access to N95?
So that's not correct. The infection prevention and control guidelines have been updated. They do reflect the fact that we have an abundant supply now of respirators, and that they are accessible to healthcare workers in the situations that they need them across the province. And that's something we're reinforcing with our healthcare settings across the province.
Our next question is from Keith Baldry, CKNW. Please go ahead.
Oh, hi, thank you. The positivity rate seems to be exploding across the country, particularly Ontario and Quebec. But here in BC, we've gone from 9% rolling 7-day average on Friday to almost 15% today. Is there any reason to think that that's not going to continue to climb in the short term, which means we'll be hitting 4,000, 5,000, 6,000 cases a day? And is there any way to determine whether Omicron is definitively behind this real surge in positivity?
Yeah, it definitely is Omicron. We know by our whole genome sequencing that has really taken off. It's about, I actually haven't seen the data for today yet, but, we expect that the majority of these, whether it's up to 70 or 80% now, I'm not entirely sure, but it is in that realm. So this is being driven by Omicron across the board. And yes, our positivity rates are going up. They've took off first in the areas where they were the lowest, Vancouver Coastal and Fraser Health, and the one-day test positivity in Coastal today was around 20%. So we do expect that. However, the things that we are doing are also helping to dampen that. What we're trying to do, because we cannot stop the spread, what we can do is try and flatten it down and draw it out a little bit so that we are not seeing a rush on our hospitals. And this is something that I've been talking with my colleagues on this weekend across the country and elsewhere. There is an uptick, quite a strong increase in hospitalizations in Quebec, and what is driving that is one of the things we're trying to understand. We've taken some measures here to try and protect our healthcare system, including things like cancelling surgeries, which is a very serious measure, both to try and protect the capacity, but also because we're concerned about healthcare worker absenteeism, given how we're seeing this spread in the community. So there's a lot that we don't yet know. I'm hopeful that the things that we're all doing collectively, like not having those large gatherings and trying to prevent ourselves from transmitting to others if we get sick, those will keep us from having continually increasing rates. But it's in our hands now. I don't know if you want to add to that. Yeah.
Heath, did you have a follow-up?
Yes, in terms of the booster doses, Minister Dix mentioned almost 250,000 people have received invitations to book, but have yet to do so. I know the uptake for third doses wasn't expected to be as high, perhaps, as second doses, but does this strike either of you as unusually a high number of people have been offered to take to book a third dose, yet to take the opportunity to do that? And it doesn't sort of make the whole argument of whether it's a 6-month or 3-month interval almost a moot argument if so many people just aren't taking that third dose?
Yeah, we really, our strategy has been, since we made the decision around booster doses, is to protect those most at risk first. And we do have good, strong vaccine effectiveness. And I just saw some preliminary data that will be coming out very soon from BC CDC on to up to 8 months, where protection from hospitalization is still very strong in the 90% range. So that's good. The protection, you saw some data from the Science Table Ontario against infection has gone down quite dramatically. We haven't seen that yet here. We just haven't collected enough of that information yet to be able to look at that. But it's, I can only just say it again. If you're due for a booster dose, get it now. There are a number of people that are asking for it. There's a number of people who, like with all of this, have been complacent or have other reasons why they haven't yet got their booster dose. So more and more people will be invited to book their boosters, and more pharmacies and larger clinics are coming online in the next couple of weeks. So we can move that up for more and more people.
I think the purpose of saying this, Keith, is simply to say that there are spots available. I think sometimes people may think there are not. And it is a little bit different in different health authorities. For example, our health authority clinics based in Vancouver Island are fully booked this week, and in other health authorities there's a lot more room. So it's not necessarily consistent around the province. But I think what it tells us is that the number of bookings is going up significantly. The number of people who are getting their 6 months has also increased significantly in the hundreds of thousands in the last week, for example. So we're in this period where people will need to catch up to the situation, understand that when you receive your notification to book, the sooner you book, the sooner you get your booster dose, which is important for you, and that you should go ahead and do it. So I think it's much too early to sort of try and find trends in it. It's really to tell people that when they're invited to book, they should book. And I want to especially emphasize the importance for healthcare workers when they're invited to book. That's a critical thing that they need to do.
We have time for one more question. Our last question today is from Belle Puri, CBC. Please go ahead.
Hi there. Of course, we need our answers in English and French, please. So now we're in a situation that, the danger of Omicron is so severe that the start of the school term needs to be delayed for most students. So can you explain, please, why the province didn't make it mandatory for teachers and school staff to be vaccinated, as government did virtually with every other public sector job in the province? And Dr. Henry, you talk about, we'll know more about the variant in the next week, and the phase-in is to see what's happening in the community. So there's a chance this phase-in, this delay to the start of the term, could be extended?
The answer to that is no. This is just giving us a bit more time to deal with the situation that we're in and to plan for things like absenteeism, because we're starting to see that, as we mentioned, in healthcare and across the board. So it really is about continuity planning and making sure we have the best things in place. This is not a delay in start to to, what am I trying to say? This is not going to online learning, because we know that was not something that supported children across this province. It's much more important that we get them back into the classroom, and we are committed to doing that. That is our number one priority, and we're doing it in a way that recognizes the uncertainty that we're dealing with right now. And we're working together to do that with the education sector, with all of the superintendents and the schools and the teachers and, the parent groups, so that we can do it in the best possible way and minimize disruption to children and to their lives. So that's the focus of this, and we are committed to doing it. And the extra few days is to make sure that we're doing it in a way that supports the school communities across the province. As you know, I have always said that I think that every person who works in our school system should be immunized, and that's important, but it is up to the employer, which are the school districts, to bring in those policies. Having said that, we do know that across the board we have very high rates of immunization in the school staff, so that's important. That supports schools being able to operate safely, and we know we have increasing rates in children, and now more recently in children 5 to 11.
Premièrement, vous avez raison que on a pris une décision que la vaccination doit être obligatoire dans le système de santé pour des raisons importantes. On sait que d'autres provinces ont pris d'autres décisions, mais nous, en Colombie-Britannique, à dire qu'il faut que des gens dans le système de santé soient vaccinés à 100%, et on reste sur cette position. À cet égard, en ce qui concerne les écoles, la vaste majorité des enseignants, des gens qui travaillent dans le système scolaire, sont vaccinés. C'est une décision des conseils scolaires de chaque région, mais cela étant, ce qui est essentiel, c'est de créer les conditions que des gens soient sains et saufs et aussi protégés contre le COVID-19 que possible dans les écoles. C'est ce que nous sommes en train de faire, et c'est à cause de cela qu'on a pris, on va prendre la semaine prochaine pour préparer cette partie de l'année scolaire 2021-2022.
Belle, did you have a follow-up?
Yes, please, and again in English and French. So this is about the booster shots, and a lot of people being frustrated that people in their age category and younger are being given boosters in other provinces. Some are heading to the United States. Now, I know you referenced this a little bit earlier, but can you explain again why BC can't roll out this program sooner for more people? And, these 240,000 unbooked booster appointments, could those unused appointments go to people who want those boosters right now?
Yeah, so we have focused, as you know, on making sure that those most at risk have the ability to get their booster soonest first. And that has proven to be very successful for us, in that we have very high rates of getting booster doses into people 70 and over. And that was the focus. It was really making sure that those most at risk got it first and had access. And when we talk about 200,000 people that have been invited, yes, the appointments have been titrated for the invites. That means they are available, and we have been able to move other people up, and we are doing that more rapidly. But it also, again, reflects that balancing that we have to do, in that we know that that extended interval between dose 2 and dose 3, even longer than 6 months, probably gives longer lasting, stronger protection as well. So finding that balance, and I would just say that if you're coming up to your 6 months, you will be getting your booster within the next few weeks. These are ramping up quickly, and we particularly have pharmacies that are ramping up to be able to provide it for people conveniently in their communities.
And just to say, I think it's important to recognize that 151,627 clinically extremely vulnerable people in the most vulnerable categories, people who have challenges to their immune system, have been put towards the front of the line. They were for first and second doses. They are for third doses for good reason. And this will benefit them, their families, the community, the province, and the healthcare system. It's an important thing to do. So often, if someone's getting it before you, it's for that reason. Or it's because they've received 2 doses of AstraZeneca and it's been determined by our clinical experts that they should get it as soon as possible at 6 months. Or otherwise, it's age, clinically vulnerable. We have given priority to Indigenous communities, as we should, given the vulnerability often of those communities, especially isolated communities around the province, should a variant of concern visit them. And so more than 50% of eligible Indigenous people have been vaccinated. That's an excellent recognition of the work of the First Nations Health Authority and our health authorities across BC working together. And I want to thank them for their exceptional, extraordinary efforts, as I do the First Nations Leadership Council and First Nations and Indigenous leaders across BC. Je dirais en français qu'on a donné la priorité à ceux qui ont le plus besoin de la vaccination, qui sont les plus vulnérables. Et on va continuer à le faire. Et on va avancer ce système avec plus de vaccination dans les semaines à venir. Donc, je veux dire à tout le monde qui a reçu une invitation d'être vacciné, de le poursuivre. Et je pense que ça, c'est la chose importante maintenant. Et je pense pour tout le monde dans la province, c'est important quand on est invité à être vacciné, d'être vacciné. Ça, c'est la chose importante. Et ça va arriver à tout le monde parce que tout le monde va avoir accès à une 3e dose. Et donc, ça va se dérouler dans les premiers mois de 2022. Merci beaucoup. Thank you very much. We'll see you on Friday.